After decades of war and social upheaval, the people of Afghanistan continue to endure tumultuous change and devastating hardships. In Afghanistan today, 42% of the people live below the poverty line. The maternal mortality rate is the second highest worldwide. The infant mortality rate is 165 out of every 1,000 live births. One child in 5 does not reach age 5. 77% do not have safe drinking water. 88% don't have adequate sanitation. And 45% don't have adequate food supplies. American support for Afghanistan is a non-sectarian, non-governmental, and apolitical nonprofit organization dedicated to the restoration and continuing development of Afghanistan. ASA empowers and encourages Afghan citizens to participate in the rebuilding of their own communities and works to establish greater security and economic potential on a community level by addressing the most pressing needs first, such as healthcare, education, housing, orphans, and refugees. ASA facilitates direct funding to partner organizations and provides material goods directly to Afghan citizens in partnership with other organizations such as NATO's International Security Assistance Force, or ISAF, STEP Health and Development, and the Wheelchair Foundation. Many medical professionals have fled the country since the 1980s. Current estimates indicate that a quarter of the population has no access to health care. ASA has positively impacted the lives of many by handing out hundreds of wheelchairs in partnership with the Wheelchair Foundation, as well as providing many essential medications to the Aliabad Hospital in Kabul. With additional resources, ASA will continue to help provide essential medicines, medical instruments, and supplies to the people of Afghanistan, with additional plans to provide assistance in physician training, prevention programs, family planning, and hygiene. Afghan winters are particularly harsh and can be devastating for those who are the least prepared to endure the frigid temperatures and scarce supplies. The ASA works with NATO each year to provide winter clothing, infant supplies, toys, and books to help needy Afghans through this most difficult season. There are an estimated 1.6 million orphans and 1 million widows in Afghanistan. UNHCR estimates 50,000 to 60,000 street kids in Kabul. Children are often seen begging or trying to sell various items such as chewing gum or plastic bags just to survive. Street kids are disproportionately vulnerable to sexual exploitation and drug abuse. They are also vulnerable targets of Al-Qaeda, the Taliban, local warlords, and drug dealers. 60% of elementary school-aged children do not attend school. 65% of these are girls. ASA sponsors needy children, providing food, medical services, and facilitating their ongoing education. For just $600 per year, ASA provides a needy child with the food, medical care, school supplies, clothing, and shoes that they need. To ensure continued progress, each child's ongoing support is contingent on their participation in government-funded education programs. ASA has plans to provide resources for school construction and supply costs, teacher training and salary supplements, and adult education projects such as literacy programs and vocation training services. UN sources indicate that there are around 150,000 internally displaced persons, or IDPs, mostly in the southern and western areas of the country. This does not include those temporarily displaced by conflict. ASA currently provides blankets and winter clothing to displaced persons and plans to expand assistance, as resources permit, for those who are forced into IDP camps. There are many ways that you can help us make a difference in the lives of those who need you the most. please contact us for more information.